Welcome to another episode of the Thriving Dentist Show. I'm Gary Takish, your podcast co-host. I have a very exciting episode for you today. Those of you that are regular listeners know that we mix formats up to kind of keep things interesting for our listeners. And today is going to be an interview format with a very dear friend, a colleague, a fellow triathlete, and wait for it, the president-elect of the ADA, Dr. Brett Kessler. Hey, Brett, how are you?
Hey, Gary. It's great to be here again. I think this is probably our fifth recorded talk.
Yeah, I was going to
Maybe
comment
more.
that
Yeah.
if they're a regular listener, they'll recognize your name and voice because we've had you on the podcast in the past,
Yeah.
but not in this role.
Right.
But Brett is a practicing dentist, a wet glove dentist. Although his practicing is reduced from what it was in the past because of his commitments in terms of the ADA. But he's also a very dear friend, and he's been a frequent collaborator with me in teaching at dental school. Brett, I have to tell you, the guest lectures you've provided for my D3 class have been extremely impactful. And I want to thank you for your commitment to, sharing your life experiences and your wisdom and your passion with our dental students.
Well, yeah, that to me is one of the highlights of my commitments in organized dentistry is getting to speak to dental students about wellness. You know, I entered dental school with a substance abuse problem, and I exited dental school with a worse one. And I didn't know there were other people out there that got through it. And so when I hit my bottom in my third year of practice. And so when I get the opportunity to talk to dental students about my path through bottom, and I call it rock bottom and now to significance, I hope that, I can inspire people to actually remind them that they are their most valuable asset, and they must take care of themselves as such.
Brett, I'm going to put a link to one of the episodes that you did on the Thriving Dentist Show about your journey from addiction to health. I'll put a link there for our listeners that are new and maybe haven't heard that. So you can go to thrivingdentist.com, hit podcast, and scroll down and find this episode. And there'll be a link there to listen to that full story. And it's absolutely a powerful story. And Brett, I can't thank you enough for your transparency and just the sharing of the journey, and the message is such a positive message of a future, of a sober future. And I know I have because I have family history with substance abuse. I have your sobriety date on my calendar, and it's a date I celebrate with you every year.
I appreciate that. It takes a village. You're on these paths in life, and I have this saying that angels appear along the path to give you a message and walk with you, and you've been one of those unexpected angels. When we first started working together at Pack Live, who knew? 20 years later, we'd be talking about life and the best parts of life after hitting the worst parts of life. So you've been a great friend and mentor and supporter and confidant and et cetera, et cetera, et cetera. So I appreciate you.
And I love the way you describe it as from addiction to significance, and it's such a powerful inspiration. And it's also allowing us to address the topic of mental health. I think there was a time, if we think about it, in our experience in the career, there was a time where mental health issues were kind of swept under the rug and ignored, and it was kind of something that could always happen to someone else.
Right.
But of course, it wouldn't be you.
Well, mental illness is the only illness that tells you don't have it.
Well said.
So it's,
exactly.
You have to figure it out through, I find by sharing my story, other people can identify, yeah, I kind of feel the same way, or I'm, experiencing the same things or exhibiting the same behaviors. And it's not productive for my preferred future.
Right.
So,
Right.
it's got to come from externally most of the time.
Yeah.
Yeah.
Yeah. Well, again, thanks for all that you do. And I know there was a time, I'll leave our listeners in suspense, but I know there was a time when you were invited to be on a local TV show, a local news segment. Uh, and you had a question about, okay, do I share my story? As you're a practicing
Right.
dentist,
Yeah.
do I share my story? Or talk about something else? And you shared your story. And I imagine
Yeah.
that took a lot of courage. But it's not only shaped who you are today, but I know for a fact that story has saved lives.
Yeah. Thank you for saying that. It's true. I always say a prayer or get into the right mindset that whenever I share my story, I pray that somebody hears what they need to hear through my words of experience.
Yeah.
And I
Yeah.
never know who's listening. I never know what they hear. I never know when they hear it. And so I have to keep sharing.
Right.
So,
Well,
yeah.
thank you.
Okay.
Uh, Brett, let's pivot and talk about your experience with organized dentistry. Um, I know you're a former trustee. Um, so talk about that. If I can simply share to our audience, there's a lot of discussion today among dentists at every stage of their career about being involved, in organized dentistry. And I, for one, am an absolute advocate of getting involved at every level, at the membership level, to have a voice at the table. And young dentists, sometimes they'll question, like, I don't understand what the value is. I don't understand what I get out of this. And I think it's a fair question. But I think at a core level, it's important to, if we want to shape the future of our profession at the organized dentistry level, it's important to have a seat at the table.
100%.
And
100%. And yeah.
I imagine that might have been although you've been involved in organized dentistry from the beginning of your career. Is that correct?
Yeah. My first job, my boss told me, I was an associate in Flint, Michigan, and my boss told me that if we are to remain a profession, everybody has to contribute to that profession in some way. At very least, you need to be a member of the ADA. I feel so strongly about that. As a benefit of working with me, I'm going to pay for your dues. And so that was my involvement in organized dentistry. I didn't care really up till then. No one ever said anything. I was an ASDA member in dental school, but not very active. And it wasn't active. I kind of made fun of the ASDA people, because I just didn't see how it related to me and my future, because I didn't know. But when I hit my bottom, I called the Dental Association for help, and they guided me towards help. Okay, so that's first benefit that I got from organized dentistry. When I moved from Michigan to Colorado, I applied for my license, and I had to answer certain questions about my history. And because of that, I was put on probation with my license, and that pissed me off, basically. And a few years later, the Colorado Dental Association was having what we call sunset review, where they update the Practice Act. And so we are governed, every state has a Practice Act that is governed by the state legislature. There are hardly any dentists in the state legislature. And so we, as our state dental association, have an obligation to provide the best forum for dentists to practice in a way that serves the community maximally. And so the Dental Practice Act guides that in a safe way. But legislators who regulate it have no idea about it. So we have to be a voice. So one of the reasons I wanted to get in on that sunset review was to change that that questioning and to be put on probation. And so we did. And then they, kept me involved in certain ways. And I did end up, you mentioned a media story that I was involved in. One of those media stories got picked up nationally and went on CNN. And that's how the ADA found out about me, and invited me to Washington, D.C. to testify on a bill to help support drug addicts, methamphetamine addicts in recovery to get their teeth fixed. And and when I got back from Washington, the Colorado Dental Association said, well, Brett, no one's ever testified before U.S. Congress before. Maybe we can bring you into our leadership and see what you got. And they people along the way, angels again, saw things in me, leadership qualities in me that would serve the greater good in a very unique way. And not just around wellness, but about, insurance reform or best practices and other things, and encouraging the next group of leaders. And so that's been my charge. And my most proud accomplishment when I was president of Colorado Dental Association was I was part of a team that developed a dental benefit in the Medicare space for adults in Colorado. So now 300,000 people had opportunities to get their teeth fixed. And a lot of these people were they didn't have a lot of money, but a lot of them were recovering alcoholics and drug addicts that needed the scars of their addiction removed from their face. And so that was my backward motivation. But 300,000 people now had access to benefits. When I was done with being in leadership in Colorado, I was asked by one of our trustees from our district, the 14th district, Gary Yanamoto from Hawaii. He was our trustee. He asked me to serve on the Council on Dental Benefit Programs and at the ADA level. And I'm like, Gary, I know nothing about dental insurance. I practice fee for service, 100% free of dental insurance my entire career. And, he's like, well, Brett, you need to be there. Yeah, I don't know why. I didn't know why, but I trusted Gary, and I valued him as a leader, and I value the process because so many people saw things in me that I didn't see in myself, and so I just went with the flow. He's one of those angels, and I got involved on that level, and I went up to become vice chair of that council, and during that tenure, we were asked some things to develop. We were actually looking to develop an insurance benefit plan to enter the market to compete with the current status quo. And so we did a real deep dive on how the dental benefits work. What's the mechanics of that business model? But we found we really couldn't get the traction we wanted to get and disrupt the market in a meaningful way that it would have taken over in anytime soon. So we decided to put that on the shelf. In the meantime, there was a group of people of different entities around the country that were looking to push a dental benefit in the Medicare space, and they were very organized. So Medicaid is for people who don't have a lot of money. Medicare is for people 65 and up, like you, Gary, old guy.
Will be.
Just have to throw that in.
In fact, Brad, my wife and I married the older woman. By 2 months. we'll celebrate 42 years of marriage this coming August. But
awesome.
Right now we are in the throes of looking at all these Medicare options.
Right.
She turned 65 in May, and I turned 65 in July.
And so as you're looking there, it got pretty good medical coverage, and pretty much everyone of that age and above has that for medical, but there is no dental coverage for that. And so we were asked if it were to be introduced, because it's legislative, we need to be ready. And so we developed a plan that we felt would be, provide dentists a fair compensation level with minimal administrative burden, minimal risk of audits, and a comprehensive enough that we can do actual dentistry that would improve patients' overall health. Okay. And so it checked all the boxes. It was as good as any insurance plan that 95% of the dentists currently take.
Well,
And
in some ways better. Like for example, Brett, I know of some Medicare supplemental plans
mhm,
for dentistry that have an annual award, for example, that is significantly higher than we normally see. A typical annual award among regular dental insurance is $1,500 a year. Would you
right.
agree that that's probably
Yeah.
the median?
Right.
And
Uh-huh.
yet I've seen some Medicare supplemental plans that have annual awards for dentistry at $3,500 a year, $4,000 a year,
Yeah.
with very attractive fee schedules that allow dentists to do
To want to
quality
be part of it.
dentistry,
Right.
to be part of
Yeah.
it. Yeah.
Yeah. And so we'll come back to that in a second. So this was just a what if it was, and we wanted to be ready. And it turned out to be a real controversial subject within the ADA because, we're kind of independent. We don't like government. We don't want government intrusion. We hear from our physician friends, blah, blah, blah. And so, so we just had it in there as just in case. And this topic has been going on since 2016. I've been involved with it from the beginning, and now we're in 2024. And the bottom line for me is Medicare the best thing for dentistry? I don't know, but we have to find ways as a profession, as the ADA. Our mission is to ensure success for our members and and improve the overall health of the communities. We have a dual mission, okay? And everything that we have to do has to go through those two lenses. And
So
so,
your constituencies then are the two level would be the dentists, the providers, but
mhm,
also the recipients of the care, the patients. Am I
exactly,
looking at that correctly?
exactly. That's how we stay a profession. Otherwise, we turn into a trade.
Right.
Okay.
That makes
So,
perfect sense.
yeah. And so I decided, throughout, my term on CDVP, I wanted to see that through to make sure we're at the table. And also I was involved with a clinical data registry, and data is king in the world right now. You own the data, you own the world. And just ask Amazon, just ask Apple, just ask Google. Okay. Data is king. And in the dental world, the dental benefit plans, the insurance companies own the data,
Right.
and it's called claims data. And the claims data has allowed insurance companies to say a 5-year replacement clause is what is the cultural norm. So if you had a crown, you can get it replaced within 5 years. If not, the dentist must redo it on their own dime. Okay. But it has nothing to do with that patient the day you put that crown in. If that patient doesn't brush their teeth again or floss or starts to develop a methamphetamine habit, okay, there is no way that crown is going to last 5 years. And
Right.
so so we have to look at it from another angle with diagnosis. And there's claims codes and there's diagnostic codes. And we don't put diagnostic codes in as a rule. And so this clinical data registry is basically mining backdoor, mining information backdoor in many private practice models, and they're requiring them to have diagnostic codes on our patients that the work we're doing. So, for example, the diagnosis of caries on tooth number 12, that's a diagnosis. There's a diagnosis of xerostomia or dry mouth. There's a diagnostic code of clenching, grinding, parafunctional habits. Medical diagnosis of diabetes, diagnosis of periodontal bone loss. All those things will go into the in the flow chart of how long that filling is really going to last. And we can't figure that out unless we have diagnostic codes to
And
find
yet,
out truly
is it
what is
accurate to
working.
say, Brett, that the diagnostic codes have sort of disappeared from the practice of doctors and office managers?
Yeah,
They're not usually using the diagnostic codes. Um,
right,
and what I always hear, I always ask, well, why don't you have the diagnostic codes in there? It says, because we don't get paid for them.
right, right. If the dental benefit plans required it for payment, everyone would have to do it because of the 95% market share of those who take dental benefits. So anyway, and they're in no hurry to do that. And the dental um, software, practice management software companies don't want to do it either. It costs a lot of money to redo their systems and things like that. So they're in no hurry to do that. But we've got several thousand dentists who are willing to do this for the cause, and it's all the patient data is de-identified and things like that. And so as we develop more and more of a robust data set, we'll be able to cut up those data sets to really see what true best practices are and develop quality measures on what works and what doesn't in what environments. So that's pretty exciting. So those things in place made me want to run for trustee of the ADA. Okay, trustee of the ADA is basically the board of directors of the organization.
That's a good way to think of it. I just organizationally, you bet.
Right. And so then during the 4 years, I was on the board. Year one, COVID hit. Okay. Nobody saw that coming.
Right.
And it was the hardest year of our lives on the board, but it was a year that I'm so glad to be at the table to help figure this out.
As we're recording this, a little interesting coincidence of timing. As you and I are recording this, we are almost 4 years to the day when the world went upside down.
Right.
Almost.
When Rudy Gobert from the Utah Jazz came down with COVID,
right,
and they canceled the game. I'm like, oh boy, the NBA is billions of dollars of revenue they're about to give up as they canceled their season while they figured this out. The government, in the meantime, in their infinite wisdom, wanted to protect everybody. And all we knew about the virus is that it lived in aerosols, and dentistry's whole life is living in aerosols. So they shut us down, or they wanted to shut us down. And we said, hold up there, government, hold up. We need to stay open because people are going to need care. They're going to experience infections. They're going to have toothaches, and nobody wants to go to the ER at this time. If you remember, every hospital was empty of people except for COVID cases. But they said, if you thought you had COVID, please come to the ER, drive up in the roundabout, do not get out of your car, open your window just a crack, and they'll stick this 4-foot Q-tip through the window into your nose, and they'll pull it back out. And they're wearing spacesuits, by the way, as they put it in the reagent, and they test you. And dentistry needed to stay open for that. And we know how to deal with infection control living in aerosols. And we learned this from the HIV, and we learned it from the SARS virus epidemics and stuff like that. And so we lobbied to stay open. And
as healthcare providers, we had a real leg up on the whole topic of infection control.
Yeah.
Really going back, as you mentioned, going back to the AIDS diagnosis and the AIDS crisis of the early 1980s. And as a profession, we were probably better prepared than most healthcare.
Than all of healthcare. We weren't better prepared, except for infectious disease doctors. They knew. They're like, we don't like this one. But so we established ourselves in the essential healthcare chain at that point.
But talk about dubious timing to get your introduction to the board of trustees, huh?
That was
no one schedules. No easing into it.
No one schedules disasters, okay? And if we schedule them, they wouldn't be disasters because we'd be able to plan for them, right? And so, on the internal side, we divided the ADA into 3 segments: science. Okay, let's learn everything we can about this virus, and we put everything we had about how aerosols behave through the dental journals that we have, we put them all in front of the firewall. We shared everything with the CDC, with all the medical communities, and trying to figure everything we can about the behavior of the virus. And it's still going on. We've got all sorts of amazing research going on within the ADA on the virus, and it will help us in future pandemics, because there will be future pandemics. So 1/3 went to science, 1/3 went to lobbying. We have to make sure that, if we're closing down the dental industry, which has never happened, we don't know how long it's going to happen, but we need to find some sort of stability, dollars, so our private practitioners and our group practices, our practitioners can maintain the dental economy when we get through this, and we will get through this. So we went to the Hill and we lobbied for EIDL loans and PPP loans, so we can stay afloat and do our best in keeping our employees safe and financially sound. Okay, because it's not just us as business owners. And then the other third went into how can we practice safely, and so we figured all that out, and then we came out of there. We look back at the data, dental transmission of COVID in the dental office was less than 6%. If you were a healthcare provider in a hospital, 33% of us got sick from it, and many died. And so we established ourselves as essential health at that point. And I'm going to go back to the Affordable Care Act. When the Affordable Care Act was formed, they left dentistry off the list of essential health benefits. Okay, children's dentistry was considered essential. Adult dentistry wasn't.
Right.
Okay, but now here we are. We know our place in the healthcare chain, and so we have to. When you're considered essential, it's not conveniently essential. It's essential. And so anyway, and that was one real interesting time. We were on the phone with CDC every day. I remember our chief science officer at the time, Marcelo Araujo, reported back that he had a conversation with the head physician at the Italian embassy during COVID. And if you remember, in Italy, it was basically military rule. If you were out of your house, you had to have papers, just like in World War II. And because it was so bad, people were dying all over the place. They weren't ready, and they didn't have the capabilities to handle the volume in their hospitals. So they just locked everybody up. But so we were talking with him, and he's telling us about all the deaths and how horrible things are. And we're out of ventilators and this and that. And Marcelo asked him, "What are you doing about dentistry?" And he's like, we have no idea what to do about that. We're waiting for you all to figure it out, because the ADA is the world leader in the profession of dentistry. Yeah. And so the weight of the world was now on our shoulders. One of the phone calls I was on with a group of dentists was with the chief dental officer in Wuhan, China's dental hospital. Okay, the epicenter where this all started. Right. And he had a hospital of 200 chairs, the skyrise, not a skyrise, but a multi-floor building, and and they had zero transmission rates, and they told us what they did, and a lot of the things that we did for best practices came from that. And it was really kind of cool being able to be part of that. Right. And come out of it successfully. I know many were upset that we closed down dentistry. I'm like, well, this is, so I tell this story. Okay. And then, when it came down to it, the president of the ADA usually comes from the board of trustees. And, I had this closing window of opportunity that if I ever wanted to do it, this would be my only chance to, not to become president, but just I have a platform of things that I think need to happen in dentistry. And I think many others are in agreement with that based on me winning the election. And I wanted this opportunity, and I'm kind of a forward thinker, progressive thinker, and many dentists and many in the ADA aren't always so ready to accept the concepts that I bring forward. I was fully aware of that, but I have this small window of opportunity to have this massive platform to share my ideas. And if I can plant seeds that these ideas are important, and then if they happen if I'm president, then great. If they happen after I become president, that's great. If they happen despite me not becoming president, at least I feel like I planted those seeds and took advantage of that closing door of opportunity. So
well, I and many others are very excited for your term to have you at the helm